So with that, I'm going to turn it over to Stella, who is from the North Carolina Department of Health and Human Services, and we're just happy you're here.
Thank you so much. Good morning, everyone, and welcome to the summit. I'm very pleased to be here, and I want to thank the organizers for bringing me in, because this is such an important issue. We know that the unintentional overdose rates, the deaths by substance misuse, are at their highest point ever. I was thinking about producing a big presentation for you all, but you don't need to see big graphs from the CDC or from our folks at Public Health to understand that this is affecting so many people. It's worse than ever. It is officially the beginning of what was the CDC calls the opioid epidemic. Started in 1999. We have an entire generation of adults who grew up under the shadow of opioid misuse, which is now, in looking at the full breadth of the years as we've been studying this, is not just opioids. It's a whole range of substances, and we really need to work together as communities to find those solutions. I know some of the work that I've done in the past, over the years as working in this field, is that when we worked as communities, when we worked together, we had those hard conversations between the police officers, the mental health treatment services, the substance abuse treatment services, the county commissioners and the counselors, about how we were going to resolve this problem, and understanding each one's needs, that the solutions were unexpected, but they were amazing. And oftentimes they were focused on dignity and ensuring that people in our communities have dignity in their lives, and what happens with that, and fairness, and reducing barriers, and finding our assets. So I'm going to ask you all to do something when over the course of the day. If you go to the NC DHHS website and look up the NC Opioid Action Plan settlement, and I'll make sure that I'll send the link around for everyone. In that settlement page, which is what we're here today to talk about, there's a list of things that you might want to consider for your area, because this opportunity is a once in a lifetime thing. We know we have that funding for several years, but what happens after that are the conversations that we need to work out. Where can we use that money best? And so when you're thinking about that, think about your outcomes. Think about what you want for your communities, then look at that list of services and say, okay, this is what we want. What's going to help us get there? And I promise you, there's a lot of conversations to have. So with that, I will hand it over so you can get started with those conversations. And as the day goes on, I am more than happy to answer questions. Over to you.
Okay, everyone, we're back, and we're going to talk to Stella from the Department of Health and Human Services, because one of the issues that we all seem to have and want to know more about is money. So we're going to talk to Stella about that, and settlement and things of that sort. But before I do that, I just want to remind you all that we will have CEUs for today. Don't know how many, but you are welcome to write us, contact us, and we'll let you know how many there are. And also, this is all being recorded, which I keep forgetting to tell you. So you can always come back and look at it, share it with other members of your team. That would be very important. We also have a portal inside of our website where we have all the recordings from all of the summits, all, our Charlotte event, our Asheville event, all of our learning circles, our monthly events that we do. So please take the opportunity and go there. And if you haven't already done so, you can get a ticket, and that will let you in and see all of the recordings. And it's a sliding scale, so if you have trouble with that, just let me know. We want you to have it and share it with everyone that you know, because unfortunately, some of the information in there just doesn't change from one year to the next. So, take a look. So with that, this is a really important subject, money. And I know that you know a lot about it as far as the settlement and beyond. So I'm going to give you the mic and I'm just going to let you talk.
Okay, thank you. The settlement itself is a pretty big deal. It's a national settlement, and our leadership, our government, was at the forefront in those negotiations, which is a fantastic place for the people of North Carolina. We do have that settlement funding coming down to us, and 15, so 85%, I think my percentages right, it's going to our local communities. And this is where communities are being asked, or you know, it's been given them to do stuff specifically to help communities address the opioid and the larger substance misuse epidemic that we, as I said at the opening remarks, I mean, our unintended overdose rates are highest that they've ever been. And so, and that's not just, it's not just your prescription drugs, it's not just opioids in any form, it's a whole range of substances that are now kind of feeding that.
And I know that there's more money coming, right? Isn't there? That was recently announced. So maybe within your talk, you can address that too. Like, how will that be? Do you know how that will be? Is it going to be distributed similarly?
That I don't know. I don't have the details on that one, but I do know that what will be similar is the resources that are becoming available, like on the website that I spoke about, which identifies those evidence-based options that you can consider, or counties can consider when they're thinking about spending that money. And I know that there's so much to do, right? There's so much to do, and even with this extra money, everyone is thinking, well, but we have so much to do, so where is the other funding? And so in addition to settlement funds, counties, the DHHS often releases funds for counties and community organizations to apply for things like treatment services, MAT services, diversion from the criminal justice section, but these are often short-term blocks of money. So you're often, when we do that, where it's like seed funding in a way. It needs to be considered, okay, we want to do this, so let's start doing this, but there has to be a sustainability element after that. And I think that is where, even when looking at the settlement funds, and they're quite long term, they're a lot longer, they're about 5-7 years worth of funding. What happens after that? We build this up, but how are we going to sustain it in the future? And that's where a lot of places will find, particularly with the longer spans of money, that a lot of these interventions are cost-effective interventions across the entire community. So you're reducing the number of ED visits, you're reducing the time people are spending in jail, you are reducing the time that children are spent interacting with DSS, you're improving the well-being and economic stability of your entire community by putting in place a lot of these interventions that you will find listed on the settlement website. So it's a bit of a thing to have to search through, and we will send some links. I will pull together a kind of worksheet where it has a lot of links to this and also to some federal funding. So we get federal funds, we put it out the door for capacity building, but what we really want to see are people, if they are using settlement dollars for one thing and they need to find funding for something else, that they have the infrastructure to go after this money directly from some of our federal sources. So we're really keen on helping people sort of build up that capacity to do it, because when it comes to money, and particularly when you're kind of working through governments and stuff, there's a lot of stuff that you have to keep track of, right? You can contact me about anything. I might not have the answers. I will find those answers for you and get to the right people. But certainly, my email address will be available to people here. Is there anything else you'd like to know?
So you mentioned, and I'm sure there's more we can talk about. And once again, if any of you out there have a question, just put it in the chat and somebody here will let us know so we make sure we answer those questions. You mentioned, opportunities where if you put into place some of these strategies, then you will be saving money and making money in other ways. Is there a way? I mean, so how can people calculate in a county what the savings are? So then I would say, take your savings that you would normally be investing in, ODs and whatever, and put it into strategies that can support your community. So how do you figure that?
Wow, you're full of the tough questions today. I mentioned it. So that's something that we're certainly working on providing in DHHS is looking at that cost savings. But talk to your financial planners and talk to your planners, because they're the ones. Like we can talk at a high level, but it's your planners that are going to have that information. And one thing, it is something that we all need to be very deliberate about in working that out and talking to all of your folks in the wider county kind of commission landscape, and look at those opportunities and really say, okay, this is what we want to focus on. So our Office of Strategic Business Management has a lot of this work that they're working on. They've done some cost-effective analysis on a number of programs. That those can be accessed. They need to be distilled somewhat. They are big reports, but again, we can make links to that available to people here, so they can really have a good look at this work that's going on. It's really important, and that cost effectiveness approach, that's this is what we need to do. This is going to save us. This is going to create a better and stronger community for us. It's the message that we need to get across as well.
Is there anything else that you would share about?
I'm happy to answer specific questions. I think that will be the easiest. Okay, so the question was that there is an opioid settlement commission being developed, and it is it is literally happening as we speak. So that I know that invitations have gone out and there's conversations being had. And this commission will operate as many of the other commissions do across the sector. So, for instance, the Commission for Mental Health Developmental Disabilities and Substance Use Services are yes. So you know how that commission works, and they are responsible for a set of things put through legislature, and this is going to be one of those commissions. And it helps, it does help ensure voices are heard across the broader spectrum that we can then have, because this is such an important area, and it is big, a big deal. Thank you. Yeah, and yes, and as it is with all commissions, You can participate. You can go and have a look at the website and read all of the minutes. So you can become involved as much as you'd like to be involved through that mechanism. Absolutely. So that's a question. So the question was, is the state pleased with how the settlement is rolling out? I think that yes, with the caveat that this is a large and important thing that needs to happen. So yes, we're happy with how it's rolling out. We're happy that there's a significant amount of that was not retained by the legislature, is going out to the communities and the rest of the states. But it's something that we need to be organized about, and so that's where my hesitation is coming from. We're pleased with it, but it's early days, and there's a lot to do, and there's commissions to set up, and there's people to engage, and there's decisions to make, and there's more resources that we need to provide to people. So yes, the short answer, we're pleased with it, but the broader answer is that we know that it's a longer conversation than simply where we are now. There's investment in time and expertise that need to go along with it. So I want to answer a different question. Yes. So the question what Dr. Morse was expressing was his view of how there are a lot of abstinence. There are a lot of programs out there that are not evidence-based. And within that conversation, I heard two questions. I heard, can opioid settlement dollars be spent on non-evidence-based treatments and interventions? But I also heard a little bit. I heard is like, where does the state stand on this? It is actually what I think. Where we stand is that we need a treatment landscape which is embedded in evidence-based and clinical support, but which provides options for absolutely everyone. And as much as from a clinical perspective, we sometimes, it has to be open to all. And there are some people who choose abstinence-based programs. We need to appreciate that. We need to be respectful of that. But we need all those options. We need that. We need no closed door. So every opportunity that we can get someone to access treatment, we should. And the first port of call needs to be that evidence-based treatment. But people need choices. Every single person's journey through addressing their substance use disorder is unique to them. And it's an incredibly brave thing for people to do, to walk through that door of that treatment center and to go every day wake up and tell themselves, this is the route that I want to take. So our treatment service needs to respect that, and it needs to have every available option. And that is evidence-based. So it needs to be couched in evidence-based. That's our foundation. But it also needs to have options for when people are choosing something that's very personal to them. And that might be an abstinence-based. But I think that, I don't know that that landscape is there yet. And there's work to do.
Well, just a little sidebar going on here. Next time, come virtually. Come face to face. You might. Okay. So, anybody else please put your questions there. If it may have, you may have a question for Stella. Maybe you have a question for Dr. Morse or somebody else in the room, just ask your question and we'll take it and we'll answer it and we'll give you the best information we can. And if we don't have it, you know we're going to find out that answer. But it's really reassuring and gratifying to know that you are doing the work that you're doing with the passion that you have. Because, you know, at the end of the day, you could have been just a name. And here you are giving such valuable information. So I really appreciate you coming and spending the day with us here, because without you, we wouldn't have some of this information. So thank you.
Well, thank you. Without events like this, I don't know kind of what's out there. I mean, you are the people that make things happen, and it's important for me to hear what you have to say and listen and build that into understanding what's going on out there on at the coalface of the work that everyone's doing.
So take that as a request that those of you out there, I know sometimes you don't like to talk in public and you don't, but ask the questions, because you have a captive audience now. And if you've got a question that we haven't asked, that everybody will want to know someday down the road, ask it, whatever it is, because we can do things based on the questions that you're asking. We will know what actions to take, what initiatives, where we have to look, and Stella's going to help. So please feel free, if you haven't already, just add what you can. And we're going to take another little break and come back to start the rest of our afternoon. Do you have anything else over there, Carson? Oh, one more question. Go ahead.
I don't know the answer to that, but I know that there will be a lot of communication about it when those dates arrive.
And that was about the additional pharmaceutical funds coming, and there may be more. I mean, but you know what? We got a great Attorney General who is staying on top of this, right? And he is, I mean, he's at the forefront. He has been the initiator. So one thing is for sure, if anything's coming, our state's going to know about it.
That is absolutely right. We are very fortunate that RJG is right there at the forefront of this.
All right. So we're going to take a break. Don't go too far. We'll be right back.